Good afternoon, everyone. My name is Carrie McManus, and I'm here on the Pinellas County Benefits team, along with my teammate Carla Cook, who I know everybody knows. And we're so glad that you're able to take time from your afternoon to join us today. And it looks like we've got a question. Oh, there we go. Okay, and as Irina said, please feel free to ask us questions throughout the presentation. We're happy to answer any questions that you've got. So we do want to go over a number of items, including our several benefit contracts that are expiring at the end of this year, and then changes effective January 1st of 2022. And then everything that we're trying to do on our end here to make the process a little bit easier for annual enrollment. And probably most important is that if you don't want to make any changes, you don't need to do anything. You don't need to send back the change form. Any benefits that you've got now, we will make sure they carry forward into 2022. Also changing, we do have a new medical plan administrator for 2022, and then our Medicare Advantage plan for our retirees who are eligible for Medicare will be changing in 2022. And then, of course, the good news is that the majority of benefits and plans are staying the same. And we do just remind you, please ask questions whenever something pops up in your mind. Carla, what am I missing there that we should add in?
Basically, also when you are going to become Medicare eligible, this is just actually the presentation for our non-Medicare and retirees. So if you are going to become Medicare eligible this next year, we will be sending out information to you about 3 months prior to your Medicare eligible month to invite you in to enroll into our Medicare Advantage plan. That is going to be administered by Aetna starting in 2022.
Great reminder. Yeah, thank you. So we did have a number of our really important benefit contracts are expiring at the end of this year, including our medical plan, along with employee assistance and behavioral mental health, prescription drug contract, our 2 dental contracts, as well as our Medicare Advantage plan. They are all expiring December 31st. So for about the past 18 months now, our purchasing department has led a county-wide effort to obtain quotations from any capable vendors out there in the marketplace to respond to our request for proposal, and then for the county leadership to identify the best plan for our employees and retirees in 2022 and going forward. The decision did rest with the Board of County Commissioners, and that decision was made late in October. So we do have more information available for you. So the new contracts that will begin January 1st of 2022 include our medical contract, along with employee assistance and behavioral mental health, which Cigna will begin administering January 1st. Our prescription benefits will stay with Express Scripts, and Express Scripts is part of Cigna. Also, our 2 dental plans will stay with Cigna, and our Medicare Advantage plan will be moving over to Aetna, and we've gotten some really good reviews from the Pinellas County Sheriff's retirees and also the Pinellas County School Board retirees. We do have several pluses that we're adding along with Cigna, and one important one is we'll have an on-site representative who's an expert in claims and customer service, and this person will be located with our HR department on the benefits team in downtown Clearwater. This person will be able to answer questions in person or by phone, and cut out some of the middleman work that our team does, where we take information down and then we reach out to the vendor to research a claim, and then we kind of follow back up. So this will hopefully improve any claim issues that you might experience. We also have a single phone number for retirees to call, and we can share that with you today. The phone number is available now, and the Cigna representatives can look up in-network providers for you, and then also provide information about our medical plan options. And then also we can all use this one phone number to reach the other benefit plans, such as prescription drug and the dental plans.
So if you remember, Kathy Baker that used to be with United Healthcare was our claims administrator, helped with all the claims. This new individual that's going to be on site is going to be doing very similar to what Kathy Baker was doing when she was here. So that will help us tremendously with all of the knowledge that this claims representative will give us. So to feel free to reach out, and we'll get you in touch with this claim administrator once they're here and available. It'll be after the 1st of January.
Yep. And we do have a question about posting the Cigna contact information, and it is out on the HR County website. We have a page, it's called Annual Enrollment for Retirees, and that's kind of the best place to start for information. But we will share the Cigna phone number with you in just a couple slides upcoming. We do want to let anyone know who might be undergoing perhaps a surgery later this year and you anticipate your recovery going forward into 2022. Transition of care will be available, and Cigna will be coordinating that with us to make sure you have a smooth transition of medical benefits from 2021 with United into 2022. And yes, the on-site representative will definitely be available to retirees. And this would be for retirees who are not yet Medicare eligible, since the employee plan and retirees who are not yet Medicare eligible, we will all be on the Cigna plan starting January 1st. And that representative will be able to help with Cigna and Express Scripts. So prior authorizations will be honored going forward 90 days after the 1st of January. And then Cigna will work with your providers to transition any authorizations onto the Cigna claims administration system. We did have Cigna reprocess 12 months worth of claims for us, so we could see how many of the in-network providers with United are also in-network with Cigna. And we found out that more than 98% of the providers are in both networks, Cigna and United Healthcare. So there should be very low disruption of providers. Cigna is actively contracting with any providers who'd like to join the Cigna network, and Cigna will be happy to reach out to those providers and get the process started. So for our retirees, the annual enrollment process did start November 1st, and it continues through November 22nd. Again, as we said earlier, if you don't want to make any changes, you don't need to do anything. If you did want to maybe add a dependent or drop a dependent or change your dental plan, we did include a change form. Hopefully you received that by mail. If not, let us know and we'll mail out a follow-up copy to you. But that's only needed if you do want to make a change. And then any changes that anyone makes are effective on January 1st. So for the first time, we're actually offering a webinar for our retirees today for anyone on the non-Medicare Advantage plan. And then we have a webinar tomorrow for our Medicare Advantage plan retirees. So this is a first, and as Irina said, this is being recorded. So if anyone couldn't join us live, they can listen to the recording at a later date that's more convenient for them. On tomorrow's webinar for the Medicare Advantage plan, we will have an Aetna representative join our webinar. And of course, our employee benefits team can be reached from 7:30 a.m. through 5 p.m., Monday through Friday. And Cigna has a pre-enrollment line that we mentioned, and we're going to give you that phone number. I think it's coming up. Here it is. So this is the toll-free phone number to reach Cigna. We can all call this phone number now, and the representatives will kind of go over our two plan options for us, and they can look up in-network providers. Keep in mind that they haven't received our benefits enrollment yet. We'll be sending that over in early December. So if I do call this number now, the person I speak with won't be able to see my enrollment in their system yet. They will be able to see that in December, and of course, prepare new ID cards for us and mail those out to our home. Let's see. They can also answer questions about the plan design, so the co-insurance and the co-pays. and also help us navigate between the two plans, point of service and the consumer-driven health plan with the health savings account. So as far as changes for 2022, just the change to Cigna for the medical plan, along with employee assistance and behavioral mental health. And for anyone in the consumer-driven health plan, the health savings account maximum for 2022 is $3,650 for an individual and $7,300 for a family. And we've got some guidance there if you do want to check yourself online and see if your providers are in network with Cigna. If you want to maybe take a screenshot or take a picture with your camera. Also, of course, you can call Cigna's toll-free number, and the representatives will be glad to assist you with looking up any of your providers or hospitals or labs. So also probably the most important news that we all like to hear is that the premium contributions are staying flat for 2022. No changes there. So our plan for employees and retirees who are not yet eligible for Medicare is a self-funded plan or self-insured. So we're able to keep the plan design exactly the same in 2022 as we have currently. As we mentioned, our pharmacy plan will stay with Express Scripts, and they're kind of that behind the scenes company that processes all prescription drug claims for us. We can go to probably the majority of the local retail pharmacies are in the Express Scripts network. And of course, home delivery services are available with Express Scripts if anybody wants to take advantage of that. And our two Cigna dental plans are staying the same as well, along with those rates. No changes to our medical plan options. We've got the same two plans available in 2022 that we had currently, and all preventive care, including wellness exams, lab work, and cancer screenings are covered at no cost to us. The Cigna network is called Open Access Plus, and you'll see it abbreviated as OAP. The same medical services are covered by both medical plan options, no matter which one you choose. And we do pay the same monthly premium contribution, whether we choose point of service or consumer driven. So no changes here. This is the comparison between the point of service and consumer driven plan annual deductible and the out-of-pocket maximum for the two plans. And of course, for anyone who elects the consumer driven health plan, the county does make a contribution to your HSA. No changes to the benefit plan features with either medical plan. The point of service plan does offer copays for many of the common types of services, and the consumer driven plan, we do pay the negotiated rate, which counts towards our deductible. No changes to our prescription drug plan. On the point of service plan, we do have a copay for generic medications, and then brand name medications are covered at coinsurance with a minimum and a maximum. And on the consumer driven plan, preventive medications that we take for chronic conditions, sometimes called maintenance medications, those are covered at no cost to the consumer driven health plan members. And then any other medications, generics and brand name, are covered at the negotiated rate, and then that counts towards our deductible.
Sorry, technical difficulties here.
So just a reminder on the health savings account, this comes along with the consumer driven health plan, and the county does make a contribution, $400 if you enroll just yourself in the plan. If you enroll one or more family members, the county will contribute $1,200. New this year, we're really excited about this because it should make the process easier for everybody. The county is able to automatically open up a health savings account for each plan member. Cigna's health savings account banking partner is called HSA Bank. So for anyone who elects the consumer driven plan, you will have an account at HSA Bank for 2022. The IRS maximums are shown there on your screen. And as a reminder, any health savings account, you can make additional contributions beyond the county's contribution up to those maximums. And there's no requirement to use your funds in any given year. Those funds will continue to grow and increase, and they grow tax-free. And then later on, when you do use the funds for qualified health expenses, the funds are used on a tax-free basis. The account is 100% portable. So if for any reason you happen to leave the county's health plan, you would take your health savings account with you. So for qualifying events, that gives us the chance to make mid-year plan changes in the event of a marriage or divorce, birth of a child, or perhaps adopting a child, or if your dependent gains coverage elsewhere or loses other coverage. We do have a change form to complete. It's on our website, or if you'd like us to email a copy or mail a copy out to you, we'd be happy to do that. Just let the benefits team know. And we do just need that change form back within 31 days of the date of your event. And then you can make corresponding changes to your benefit plan. Reminder about our Smart 90 program. This is for our prescription drug program. We've had it in place for a number of years, and it's designed to help save money for our retirees as well as for the county. With the Smart 90 program, for any maintenance medications prescribed to treat chronic conditions, we can fill a 90-day supply and just pay for 2 months worth of the medication. And we do have our choice between using a local Walgreens pharmacy, or we can use Express Scripts home delivery. And again, this would be anything taken for a chronic condition like high blood pressure or high cholesterol. In the event that I'm filling one of these medications and I choose to use a local retail pharmacy other than Walgreens, I would pay the full retail cost out of my pocket. There's definitely other cost savings options out there. For example, several of the large retail chains, including Publix and Walmart, have in-store savings programs for generic medications. Not all of them, but definitely many of the common generics. And then also many brand name medications and specialty medications have discount cards that the pharmacy manufacturers provide to help us save money. So take a look for those if it might be appropriate for you. Virtual visits are available, and Cigna's partner for virtual visits, they're called MD Live. And by virtual visits in this instance, we're referring to just MD Live, where we can have a visit by phone or through our webcam on our computer or our smartphone or our tablet. And these are board certified physicians available to us 24 hours a day, 7 days a week, from the comfort of our home, or if we're perhaps traveling. And usually it's to treat a chronic condition, such as some of the ones shown on your screen there. But there's also virtual visits available for behavioral and mental health. And the board certified physicians can send any necessary prescriptions to the pharmacy of your choice. So no changes to our vision plan, and this coverage is bundled in with our retiree medical plan. And great question, I'll answer that just in 1 minute. IMED is our vision plan administrator, and this would be for routine vision. So if I have an injury to my eye or any kind of illness, I would see an ophthalmologist under our medical plan. But for a routine eye exam or contact lenses or eyeglasses, I can use our IMED plan. And this is part of your retiree medical plan. So for our Optum Bank HSA, that will stay in place. We were trying to see if we could do a bulk transfer of everybody's health savings account funds from Optum Bank over to the new HSA Bank. And Carla, correct me if I'm wrong, but I think we're not able to do that without getting each person's consent.
That's correct. And we will be sending more information out to our individuals that are currently in our high deductible plan that does have an Optum account. And we're still getting different ways for us to handle that. It will be per individual if they would like to open up, roll their Optum account over to the HSA account, or they can leave it into the Optum account and have the two accounts going. But we will be sending out more information just as quickly as we gather that.
That's great. Yeah, thank you. Great question. Thank you. So Cigna will be the administrator for our employee assistance program, and this is a great program available at no cost to us, and we're allowed up to 6 sessions per type of issue. So this is available to retirees as well as your immediate family members. And there's many types of issues that we might seek assistance with, such as maybe financial matters or legal matters, relationship or family matters. The EAP folks can help us locate childcare or elder care. And if anybody is seeking employee assistance and would like to continue visits with the provider, all of the Cigna EAP providers are also in network with Cigna's Behavioral Mental Health Network. And if we did transition past those six sessions for the same type of issue, we would just pay the office visit copay, which would be the equivalent of the primary care family physician copay. No changes to our life insurance plan. So if you've got retiree life insurance, our insurance company is called Securian Financial. We do encourage everybody to please review your beneficiaries at the annual enrollment period. Of course, you can make a change to your beneficiary at any time of year. We do have beneficiary forms available on our website, or if you'd like us to mail a copy out to you, just let us know and we'd be happy to put a copy in the mail, or we could send you a copy by email. And on your screen, we've got the web address for kind of the starting point for annual enrollment. And we do have a page for employees and then a separate page for retirees to really focus on retiree benefits. From that page, we do have links to all of our benefit vendor partners' websites. And also we've got our employee benefits team email address there, along with our phone number and our physical address. And we're all in the office if anybody wants to stop by and visit with us. And we've got a question, once on Medicare, can we still have life insurance coverage? Great question. Absolutely, yes. If you have elected retiree life insurance at retirement, you can definitely keep that life insurance throughout your retirement. The benefit amount does reduce at certain ages, age 65, 70, 75, and 80, and then at age 80, the amount does stay in place. It doesn't reduce any further. But yeah, great question. Absolutely, you can keep that life insurance.
Yeah, once you become Medicare eligible, it does not have any type of effect on your dental or your life insurance if you have those. Those will continue on, even if you choose not to continue with the county's Medicare plan. We would let you continue with the dental and life insurance if you need to. Also, we like to make sure that you definitely watch and open up your mail. I know you're getting inundated with all types of mailings coming to your house right now, but please make sure you do open up your mail and at least look for the Pinellas County dual branded logo on any of your Cigna mailings. You will be receiving new insurance cards mid-December. You will also, if you have the dental plan, you are going to be receiving dental cards this year as well. And this is all for the January 1st, 2022 start.
And we do have a question. If a spouse goes to Medicare a year before me and I keep dental for him, yeah, that's true, Carla, right?
Yes, you can keep the dental on your spouse once they become Medicare eligible. Yep. Each plan is different, so you can have a spouse on your health plan and not include them on the dental plan. And then during annual enrollment of the following year, you can add them to the dental plan and remove them from the health plan. We can do multiple things with the health and the dental.
And then one question that we do get quite a bit is, if a retiree spouse is going to become Medicare eligible first and wants to jump off our plan and then later come back to our plan when the retiree becomes Medicare eligible, that's fine as well. So as long as the retiree remains on our health plan, you do have the freedom to drop your dependent or to later add your dependent back onto your plan, whatever is best for you and your spouse or domestic partner. Other questions? What else are we missing, Carla? We've been getting a nonstop stream of phone calls and just trying to think of some of the questions we've been answering.
Most of the questions are coming from our Medicare population, but just keep in mind that we are moving away from United Healthcare. Our non-Medicare is going to Cigna. So it's going to be a one-stop shop. You're going to have the Cigna health plan, Cigna dental plan, and the prescription is through Express Scripts, which are owned by Cigna. But once you call the Cigna help desk, they are going to be able to assist you with your prescriptions also. So you can call for your health prescriptions, mental health, and dental. So everything will be right there for you in one phone call. Well, no more questions. Well, that went through pretty quickly. So we are available for you for your phone calls. There are a number of us in the office that can help for anything that you, any questions that you have. If something else comes up that we did not talk about, but you happen to think of, definitely reach out to us, give us a call, shoot us an email. Our building is open in the lobby. We do have an HR ambassador in our lobby that can reach out to us, and we can come out and speak with you or bring you back to our offices. But we are on site during the annual enrollment process at this time.
And we have a couple more questions, Carla and Carrie. If retiree dies, can spouse still stay on plan?
Yes, if the spouse is on a plan, we will offer continuation of the plan that they are currently on, and they can continue and become the retiree at that time. And we will offer all communications will be going to that the new retiree or the spouse of the retiree. We will offer everything.
And then the next one is, I turn 65 March 30th. I become Medicare eligible starting in January. I think, will the cost change?
Okay, so you're becoming Medicare eligible prior to you becoming 65. So definitely, Ms. Dorsey, I will reach out to you and we can talk a little bit further on that as well. And I'm pretty sure I have your updated address, phone numbers on file, so I will definitely reach out to you.
Thank you.
And we'll actually have some other on-site Cigna representatives as well, in case anyone may be interested, along with the on-site claims and customer service person. We are also going to have an on-site registered nurse liaison who will have kind of expanded roles beyond our current nurse liaisons duties. And we are also going to have an on-site registered dietitian and a wellness coach. And we're even going to have an on-site EAP representative. So anybody enrolled in our Cigna plan in 2022 and beyond will be able to take advantage of those on-site resources. They will be Cigna employees, but they will be located in our HR department here in downtown Clearwater and available to our retirees as well as our employees.
That's all for now.
All right. Thank you very much for joining us today.
Thank you so much.